to the Base Face Network.
Hi, hello, assalamualaikum. So this is the topic for our presentation, which is tuberculosis disease. So let's get into it.
Hi, my name is Hawa Hadin.
Hi, I am Siti Elena Balkis binti Mama Farid.
My name is Elisa Zula binti Ismail.
Hi, it's Aina Nazura binti Razaini, and this is the list of content.
Have you guys know what tuberculosis is? Let me introduce what is tuberculosis disease. Tuberculosis, as known as TB, is an infectious disease that most often affects the lungs, but it can also affect the other part of body such as brain, kidneys, central nervous system, reproductive system, and the spine. TB is caused by a type of bacteria or germs that are spread from a person to person through the air when infected people cough, sneeze, or spit. Furthermore, you need to get to know about the symptoms of tuberculosis. The common symptoms that you feel is weight loss, loss of appetite, cough that lasts more than 3 weeks, you may be cough out mucus with blood in it, and the last is feeling tired or exhausted. Next, there is the symptoms that spread to the other part of our body such as glands, bones, or brain. You may have symptoms of swollen glands, body ache and pain, constipation, and dark or cloudy pee. The other symptoms that you need to know is pain in your chest, fever, and night sweats. These are the picture of development of tuberculosis. The picture on the top shows a healthy lung, while the picture on the bottom shows an infected lung by Mycobacterium tuberculosis.
Next, we go to the difference between latent TB infection and TB disease. Latent TB, the first difference between the latent TB and the TB disease is TB. In a latent TB, TB lives but doesn't grow in the body, while TB disease is active and grow in the body. Latent TB doesn't not make a person feel sick or have symptoms, while TB disease make a person feel sick and have symptoms. Latent TB cannot spread from person to person, while TB disease can spread from person to person. And lastly, latent TB can advance to TB disease, while TB disease can cause death if not treated fairly or
Tuberculosis has a significant impact on individuals, community, and global health. Here are some key aspects of the impact of tuberculosis. Firstly is health impact. TB is a major cause of morbidity and mortality. If not treated properly, it can be fatal. The disease primarily affects the respiratory system but can spread to other organs, leading to a range of system and complications. Next is economic impact. TB can result in significant productivity loss due to illness and, in some cases, long treatment periods. This can impact individuals' ability to work and earn a living. The costs associated with TB diagnosis, treatment, and control measures can be substantial burden on healthcare system. The last is social impact. TB can have a ripple effect on families and communities. The illness of a family member can strain relationships and affect the well-being of the entire host.
Next, moving to the next slide, which is treatment. How did this disease can be treated? So, the first one is the main treatment for tuberculosis is to take antibiotics for at least 6 months. Then the second one is if TB has spread to brain, spinal cord, or around the heart, the patient need to take a steroid medicine for a few weeks. And the last one is drugs also can be a treatment for this disease. So the first drugs is rifampin, the second one is pyrazinamide, and the last one is etambutol. So moving to the next slide, I will talk about prevention. So the first one, what you must do is when you cough, laugh, or sneeze, please cover your mouth with a tissue. Put the tissue in a cloth bag and throw it away after you use it to prevent it from people. And the second one, avoid the contact with anyone. Sleep in a bedroom. The third one to prevent from this disease is washing your hands thoroughly and often. And last but not least, please make sure that you take all of your medication correctly as your doctor advised.
Next, diagnosis tuberculosis TB. To diagnose a tuberculosis TB infection, your healthcare provider will do an exam that includes listening to you breathe with a stethoscope, checking for a swollen lymph nodes, and asking you about the question that your system TB test. Your healthcare will provide with other tests if tuberculosis is suspected. You will likely exposed to a person with the tuberculosis TB disease. You have a health risk and for active TB disease. The first one is blood test. A sample of blood is sent to the lab. One lab test will find out whether certain immune system cell can recognize tuberculosis. A positive test shows that you have either a latent TB infection or active TB disease. Or other tests of the blood sample can help you determine if you have an active disease. A negative result means you likely not have a TB infection. The second one is skin test. A tiny amount of a substance called tuberculin is injected just below the skin on the inside of one forearm. Within 48 to 72 hours, a healthcare worker will check your arms for swelling at the injection site. The size of the raised skin is used to determine a positive or negative test. This test is seen if your immune system reacts or has made an antibody to tuberculosis. A positive test indicates you likely have either a latent TB infection or active TB disease. People who have a TB vaccination might get a positive test even if they have no infection. A negative test means that your body did not react to the test. It doesn't necessarily mean you have the infection. Number 3 is spectrum test. Spectrum test, which is your healthcare provider may take a sample of the mucus that comes up when you cough, also called sputum. If you have active TB disease in your lungs or voice box, lab test can detect the bacteria. A relative quick laboratory test can tell if sputum likely has the TB bacteria, but it may be showing bacteria with a similar feature. Another lab test can confirm the presence of a TB bacteria. This result can often take several weeks. A lab test can also tell if the drug resistant form or the bacteria. This information helps your healthcare provider choose the best treatment. Other lab tests than three others tests can be include. Number 1 is breath test. Number 2 is X-ray test. That breath test a procedure to remove sputum from your lungs with a special tip. Urine test of the fluid around the spine and the brain called a cerebrospinal fluid.
Conclude that active tuberculosis is spreading and can be fatal if not treated properly. Someone who is at high risk of developing tuberculosis or experiencing any of the disease symptoms should see our doctor as soon as possible. Tuberculosis is a disease that must be reported to the State Health Department. Patients can be treated under state-approved rule and treatment plans. This is a reliable source despite immigration status, insurance coverage, or socioeconomic status. Even after successful treatment, patients may face a long-term health implication such as lung disability, and also this impacting their long-term quality.
So this is the reference that we got to use in our presentation.
It's all from us. Thank you for watching our video.